Well, today I want to talk specifically about arthritis and osteoporosis, two very common diseases in all age groups. Even embryos get it, okay? These things are just simple nutritional deficiencies. There's one that's called an autoimmune disease, rheumatoid arthritis, which is really just the nutritional deficiency disease with a secondary infection with a bug called mycoplasma, which is easily killable with an antibiotic called minocycline. And so you treat it, rheumatoid arthritis, like the nutritional deficiency arthritis, and then you take the minocycline to kill the bug, and rheumatoid arthritis, I don't care if you've had it for 40 years, goes away. Okay? And so, doctors miss these things by a million miles. It's because they don't get taught this in school. And also, they don't, make a lot of money when you talk about nutrition compared to surgeries and drugs and that sort of stuff. Okay? So, right now we're spending each year in America $626.8 billion just to treat the symptoms of arthritis. That's annually, each year in America, just to treat the symptoms of arthritis, not to prevent it or cure it. And they don't talk anything about the osteoporosis. Well, I'm going to start out with osteoporosis of the skull, okay? It's all in your head, the book. And there's 25 different diseases that are known to be caused by osteoporosis of the skull. And we're talking about AFib. Atrial fibrillation is not a heart disease. It's osteoporosis of the skull, squeezing the 10th cranial nerve. COPD, chronic obstructive pulmonary disease. Again, squeezing the 10th cranial nerve. Also, let's see here, reflux, bloating, diarrhea, gastroparesis is also caused by squeezing the 10th cranial nerve by the skull. Gastroparesis is very painful in the stomach, and doctors want you to believe you might have a ulcer, and so they want to put the tube down your throat and look around in there. You might have one of these hiatal hernias. They want to look around in there. And, they run up the bill. That's what they do. Okay? And then hiccups. Again, the recurrent nerve in the 10th is a branch of the 10th cranial nerve, causes hiccups because it's attached to the diaphragm. Bell's palsy, the squeezing of the 7th cranial nerve, which causes your face to droop on one side. ONA, optic nerve atrophy, is the skull squeezing the 2nd cranial nerve number 2, optic nerve, optic artery, optic vein, causes vision loss. We take people that are essentially clinically blind and we put them on our osteoporosis program for the skull, and in 3 days' time, their vision comes back. It freaks everybody out because it really wasn't things like, lens problems. They had cataracts or anything like that, or it wasn't just aging. It was just osteoporosis of the skull. Vertigo, okay, is dizziness. That is squeezing of the vestibular branch of the 8th cranial nerve. Meniere's disease, same thing. Tinnitus, ringing in the ears, is a squeezing of the auditory branch of the 8th cranial nerve out of the skull. Paget's disease, it was discovered, maybe well over 200 years ago by a British pathologist by the name of Paget. And he recognized that some people at death, their skulls were normal. They weren't a quarter of an inch thick like it was supposed to be. It was 2 inches, 3 inches thick. What's going on here? Well, that's because when you get osteoporosis, your bones get thicker and thicker and thicker with connective tissue trying to maintain strength and structure. Trigeminal neuralgia. Trigeminal neuralgia is the facial nerve, the 5th cranial nerve, being squeezed, causes a very terrible pain in your face, and they can call them headaches because sometimes they occur behind the eyes, on the temples, and so forth. It's the 5th cranial nerve being squeezed. And then the spinal cord paralysis from the neck down. There's about 20 different diseases there from spinal cord being squeezed. Okay? And so it's one of those things where this is not difficult. So you do need to stay away from all the bad stuff. No fried foods, no processed meats, no oils, no gluten, no wheat, bread, rye, oats, no sugar, no carbonated drinks. And then you do want to take the, I go with the Healthy Brain and Heart Pack, 1 per 100 pounds of body weight. And, of course, if you're having hemorrhage under your skin, you have osteoporosis of the bones, where the bone marrow isn't making platelets anymore. That's what's causing that. You're chronically anemic. Your bone marrow has been replaced with scar tissue because you don't have enough nutrition. So the osteoporosis has gotten into the bone marrow, and so you're not able to make red blood cells, even with injections of iron and B12. What's going on here? Well, you got to take all 90 essential nutrients, not just iron and B12, You need all the nutrients necessary for a healthy bone structure, okay, to prevent arthritis of the joints and osteoporosis of the long bones, including the bone marrow cavities, which again makes white blood cells to kill viruses and bacteria and fungus and yeast. And don't forget also your platelets and red blood cells, white blood cells, and also the antibodies and antihistamines by the stem cells, all are involved with the bone marrow. And so this is, people, you don't get to see your bone marrow. It's so important for your life and your health while you're alive and your longevity, and yet most people never get to see their bone marrow unless, they get a biopsy of it and they squirt it on a slide and you get to look at it under the microscope or something like that. But most people never get to see their bone marrow. So I urge you to pay attention to those details. And America can save $626.8 billion in just arthritis treatment. It says nothing about osteoporosis treatment. I'm going to get those numbers for osteoporosis treatment soon.